afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar, Weight Loss Surgery, an ounce of prevention is worth a pound of cure. This webinar is presented in collaboration with Friends Health Connection. Maintaining a healthy weight is key to overall good health, but it's not always easy. About 27% of New Jerseyans are considered obese, and the numbers are on the rise. For those struggling to lose weight through diet and exercise, weight loss surgery may be an option. During today's webinar, we will talk more about obesity, how to determine your BMI, weight loss strategies, and surgical interventions. Our guest today is Dr. David Ward, a bariatric surgeon at Robert Wood Johnson Physician Enterprises Bariatric and Metabolic Center. Thank you for joining us. Okay, thank you. We'll begin about 20 minutes of moderated discussion and then open it up to questions from our audience. So, Dr. Ward, thank you again for joining us. Let's start maybe by you telling us a little bit about yourself, if you wouldn't mind.
I have been in surgery for over 20 years, doing general and bariatric surgery. Started out doing mostly laparoscopic gastric banding and laparoscopic gastric bypass in the late 1990s and 2000s, and then over the past 20 years developed different modalities of weight loss surgery and got involved with metabolic centers to help with weight loss, not only surgically, but using drugs and medical management. This has enabled us to not only help patients who need surgery for weight loss, but also patients who are sort of in that gray zone. They don't qualify for surgery, but they also still need to lose like 50, 60 pounds, and it affects their health, like diabetes, hypertension, heart disease, joint problems. So using both modalities, we've developed a good program and now brought that program to Robert Wood Johnson.
Wonderful. So in our introduction, we talked a lot about obesity. What does it mean to be obese? Can you define obesity for our audience?
Sure. You sort of break it down. Everybody knows the term like BMI. So you look at people's weight relative to their height. So obviously someone who's 6'5" is different when they're 250 pounds than someone who's 5 foot. So when people get their BMI over 30, they're considered obese. And we categorize them sort of in groups of 5. So from 30 to 35, you're obese. And then you go 35 to 40, like severely obese, and over 40, morbidly obese. And those determinations determine what insurance companies are going to pay for and what the National Institute of Health sort of qualifies as proper modalities for treatment. So depending where you fall, you'll qualify for different treatment modalities, and then your insurance companies will pay for them, which helps patients afford care.
Very good. You mentioned weight. How does somebody at home calculate their BMI?
So you can, if you have a calculator, you could do kilograms over meters squared. So it's a height. But the easiest thing is to go online on Google, just type BMI calculator and put your height weight in, and it gives you a number. So it's pretty simple in terms of access to those little calculators. You can download a BMI calculator app that's really from any app store. But once again, it's based on your weight in kilograms and your height in meters squared. So just the division. It's not always accurate if you're very muscular, very so you're a big person with a lot of muscle mass. It might overestimate your BMI in terms of being what we call fat. But for most people, it's pretty accurate.
Very good. How does obesity or your weight impact somebody's health?
Well, the obvious things, whereas if I would say to everybody, if you carried around 250-pound bags of concrete on your back all day, your knees, your hips, and your ankles are going to hurt. It's the same thing when you're obese. So you're carrying that weight all the time. So it puts a lot of pressure on your joints. So you're going to not feel good. You're going to wear your joints out faster. Then as you get more fat in your abdomen, that can cause type 2 diabetes because it causes the fat causes insulin resistance. So you have more chance to be diabetic. It can increase your blood pressure, so you can be hypertensive. Having hypertension and diabetes can lead to heart disease. Also, if you have more fat around your neck, then you get sleep apnea. Sleep apnea, then you have to either be treated or you don't feel as good. You're always tired in the morning. So as your weight goes up, all those comorbidities start showing up, which leads to health problems, and your lifestyle changes. Obviously, you can't be as active, can't do as many things when you're really heavy. So there's a lot of long-term health issues as well as quality of life issues that become factors in determining how you want to treat it.
Oh, very good. What are some of the methods for losing weight? If somebody wants to get those bags off their back, so to speak, what are some options they can do to lose that weight?
So first thing is you evaluate the patient for their BMI and their health issues, what overall health problems they have. And depending on where they fall in those categories determines what we're going to offer them. So if someone's BMI is in the 30 to 35 range, you can offer more medical management. So there's medications that you can use. There's some interventions like gastric balloons now that can be put in by the gastroenterologist. As your BMI goes over 35 to 39, if you have those health issues like sleep apnea, diabetes, heart disease, osteoarthritis, then you can get surgery. If you have no comorbidities yet, you're lucky enough just to be heavy and your BMI is over 40, then you can have surgery without having to have health issues yet. So if you're a 25-year-old person and you've just been heavy since your teenage years, but you don't have health issues, you can still qualify for surgery. And the surgical procedures that we do include what they call laparoscopic gastric sleeve, where we make your stomach smaller, laparoscopic gastric bypass, where sort of bypassing the majority of your stomach, and then there's still laparoscopic gastric banding, where you put like a silicone band around the top of your stomach that restricts food.
Okay. I think you mentioned, when does somebody actually qualify for weight loss surgery?
So if your BMI is over 40, you qualify for surgery without having to have health issues. And if your BMI is between 35 and 39, you need to have health issues documented to qualify.
Okay. And that also means that you'd be a candidate for weight loss surgery as well.
Right. Yes.
So how has bariatric surgery changed over the years?
Well, if you go back to when bariatric surgery started, probably in the 50s and 60s, it was all done open surgery, so big incisions on heavy people. Obviously caused a lot of complications, more wound infections, longer hospitalization. And most heavy people, since about the end of 2000, let's say about 99 to 2000, it became more laparoscopic surgery, 5 little incisions. So more people were willing to have surgery, and the techniques got better with less complications, and more people started having surgery. Also, our society got fatter over the 1980s and 1990s with the change in our foods. So not only were the surgeries getting safer, the population got fatter. So there were more people having the surgery, so it sort of led to better techniques, better outcomes, and tracking the outcomes better. So I tell my patients, if you think about what you expect after you have surgery, if you're 100 pounds overweight, say you're 250 pounds, you're supposed to be 150 pounds, and you go to your doctor and you just want to try medications and exercise and diet, you take 100 people who are 100 pounds overweight, about 2 to 3 of those people, 5 years later, will be 50 pounds lighter. If you have surgery and the same number of people, you take 100 people, now they all have surgery for weight loss, 5 years later, about 60 of those people will be 50 pounds lighter. So you're comparing the difference between 2 to 3 people to 60 people. So surgery has a lot better outcome than just trying medications and diet. That's why there's a huge business of, see it all on TV. You can buy diet programs, diet pills, all these different programs. But if you're really heavy, it's really hard long-term to keep your weight off without some intervention. So the outcomes are so much better with surgery than they are just trying on your own.
And today, a lot of different procedures. So can you maybe explain what are some of the most common procedures done?
Sure. So the most common procedure today is laparoscopic gastric sleeve. which we don't put a sleeve in you. We're just making your stomach sort of look like a banana. So now your stomach can stretch a lot. So when you're eating, your stomach stretches to accommodate all the food. But after the surgery, we cut away, let's say 80% of your stomach. And now when you eat, you feel full really fast. And also the tissue we remove has hormones that affect how your brain senses hunger and fullness. So after the surgery, not only you don't eat as many calories, you're not hungry all the time. When you're trying to cut those calories down in a diet, usually 6 to 8 weeks after you're dieting, all you think about is food. So by the 2 months later, you gained all your weight back. The hormonal changes really last over a year, and your stomach stays small. So the volume of food you can eat is significantly less. Then there's gastric bypass surgery. Gastric bypass, we don't remove any of your stomach. We're making a small stomach that's the top portion of your stomach, and then we bypass the rest of it by using the small bowel. So you do have to connect the small bowel to the little stomach, and then the food goes out into the small bowel, bypasses the rest of your stomach and some of your small bowel. And then there's laparoscopic gastric banding, where you're putting like a inner tube, like a elastic band around the top of your stomach, sort of squeezes it and sort of makes a small stomach above and the rest of your stomach below. That is purely restrictive. It doesn't change any hormones. So those are the 3 major procedures that we do. There are gastric balloons that the GI doctors can place. Those are not, we don't consider those permanent, but you have to take those out after a few months. And then after a few months, when those come out, you really rely on the nutritionist and dietary changes. So you get a head start, but it doesn't stay in there permanently.
Great. So I've heard from members of the community that there's a lot of great health benefits from having a procedure. So can you explain what some of the benefits of weight loss surgery might be?
Sure. Just like the things that get you to be qualified for surgery, those are things that go away. The joint pain usually resolves. The diabetes, if you have type 2 diabetes, you're on medications or insulin. Many times you can get off all those medications. Your blood pressure goes down. You can sometimes get off those medications also. Sleep apnea can resolve. So even coronary artery disease can reverse with the weight loss. So there's a lot of all those comorbidities that are created by being heavy go away as you lose weight. Now, obviously, you want to be able to maintain that, because everybody says like, oh, I know somebody who had that surgery and they're fat again. And so you sort of have to say, why do certain patients have surgery and then 5 years later their weight's back? So it has to do with like a multidisciplinary approach that you have to have follow-up, you have to have nutritionists in your office, you have to have more than just 3 visits. So with Robert Wood Johnson in our Metabolic Center, there's always a nutritionist in the office. And every time you come in the office, you see myself and the nutritionist goes over what's going on. So we try to keep people from gaining their weight back by always being around and intervening ahead of time. So if you lost your 150 pounds and you start gaining weight back, it's not good to come back after you gain 100 pounds back, because that's going to be an issue. You really want to show up if you're 5 pounds, 6, 7, 8 pounds up, then you get them back and you get that weight off. So we always say like it's much easier to get off 10 pounds than is the 100 you gain back. So it's not only the surgery, it's a long-term commitment by the surgeon, the center, the nutritionist, as well as the patient. So I always tell patients, everybody's in it together. You can't look at it as, oh, I have the surgery and magic, all of a sudden it just like the weight goes away, never comes back. So it's a long-term commitment.
So you mentioned some of the benefits. Do people feel more energetic after the surgery as well? Is that one of the?
Yeah, I mean, initially you don't, because you're losing a lot of weight. It's a big change, metabolically. But usually by 2 to 3 months out, then you really feel better. So the first 8 weeks, you're probably a little tired because your calories change from maybe 2,500 to 3,000 calories a day someone eats, it goes to 800. So all of a sudden, you're losing a lot of weight. So there's a lot of changes that are occurring. Then usually by 2 to 3 months out, that drastic weight loss sort of changes and you feel a lot better, get more energy, your joint pains go away, you're more active. So there's a transition period from the first 2 to 3 months to the, that secondary period of like 3 months on where you feel really good.
So are there any possible complications from weight loss surgery? And if so, what might they be?
So each procedure has its own risk of short-term and long-term complications. So in the short term, meaning 48 hours around the time of surgery, whether if you have a gastric sleeve or gastric bypass, the major complications would be bleeding. You can have leaks from staple lines, infections. You can have blood clots. So we do a lot of things to prevent those. So we do endoscopy. We check all the staple lines at the time of surgery. You stay overnight in the hospital. Make sure you're fine before you go home. We put you on blood thinners afterwards to make sure you don't get any blood clots. With gastric sleeves, there's really not many long-term complications. Just take multivitamin B12. With gastric bypass, you have to watch, for more vitamin issues long-term, and you have to make sure you don't smoke, you don't get ulcers. There's other issues with that. And with banding, there's really minimal upfront complications. It's more long-term, actually. Make sure the band doesn't slip. You don't get problems with scar tissue around the band where you get nausea. So each procedure has its unique set of short-term, long-term complications, but overall, the procedures are very safe. So if you look at, try to say how safe is something, most of these procedures are safe as having your gallbladder out. So the safety of these procedures has really come a long way over the past 10 years.
That's fantastic. So let me ask you this. How much can somebody realistically expect to lose after surgery?
So we would say the first month, people lose about 8 to 10% of their body weight. So obviously, if you're a 500-pound person, you're going to lose more in a month than if you're a 200-pound person. So it's really percentages. So we say like someone's 250 pounds to start. The first month usually lose 20 to 25 pounds. Then the majority of their weight loss first 9 months. So if you're 250, you're supposed to be 150, you probably lose about 70 pounds over 9 months. And then the next 9 months, ideally, if you get your ideal body weight, you'll lose another 30. But the goal is to lose at least 50% of your excess body weight and keep it off. So if you're a 500-pound person, you're supposed to be 200. The idea is to keep 150 pounds off lifetime. Now you may say, well, that person didn't get back to their ideal weight. But just losing that 150 pounds makes a huge difference in terms of health issues. There's definitely, I would say, like psychosocial issues that are all about like why people gain weight. And unfortunately, I always tell my patients, I can't go home with them and change everything in their house and watch what they're eating for their entire life. So that's why it's really important to have support at your home, with your family doctor, with the metabolic center, nutritionist, even a psychologist. So it takes more than just a person. I would say you don't get to 500 pounds without some issues, and you're not going to get those issues to resolve without a lot of support. So food's an addiction, and just like any addiction, you need a lot of support.
Wonderful. This time I'd like to invite our audience to ask our physician any questions you might have regarding this topic. Again, if you click onto the chat feature, there is an area in the bottom that you can input questions. While our audience is doing that, Doctor, tell me what is the role of diet and exercise in this process as well?
So the first, I always say up front, exercise isn't a big deal because if you're overweight and you try to exercise a lot, you're going to have a lot of joint pain. So the expectation is exercise comes in later. But obviously your diet changes drastically. So it's all calorie changes in the first, 6 months to a year. And then as time goes on, as you feel better and you lost weight, then exercise becomes important especially for maintenance. Whether you're having surgery or just dieting on your own, it's all about exercise for maintenance. So if you're only 30, 40 pounds overweight and you're just getting medicine or medically managed weight loss, even without surgery, the key is the exercise helps you maintain the weights. You can't exercise your weight away unless you're like a Olympic athlete. You have to change your food because, you can exercise for 2 hours, go home and eat 3 candy bars, and you just wiped out your entire exercise routine. So it really comes down to the food you eat, and then the exercise is for maintenance. So the more you exercise, the more likely it is long-term you'll maintain your weight.
Okay. So from our audience, what are some side effects of gastric sleeve surgery in terms of like mentally, emotionally, and physically? What are the side effects?
Well, I would say, The side effects, like I say, short term, the complications could be bleeding, leaks, infections. After 48 hours, those really go down to zero. And long term, you just have to take your multivitamin and take B12, make sure your vitamins are fine. And then in terms of, people say skin, obviously, depending on how overweight you are, depending on how young you are or old you are, your family history, do you have good genes in terms of like stretchy skin that comes back, the normal skin tone, all those things go in those factors. But, most people, if you've been heavy a long time, are going to have some excess skin, and that's why they have plastic surgery. So, those are the least of the problems I tell patients. If you get to that point where you need a lot of plastic surgery, you're a success, and then, usually you can have a GoFundMe page and people give you some money for your plastic surgery.
Very nice. So at the point when someone decides they want to have weight loss surgery, what's the first step they should take?
They can look, first thing you should know is, does their insurance cover it? Unless they're going to pay out of pocket, because if you don't have insurance coverage, you're going to have to know what the costs are going to be. If your insurance covers the procedure, then it's good to look up. Every insurance company tells you what you need, and if you don't know that, you can just call the office and we'll tell you what's involved. And then you make an appointment to see myself, and then we go over if you're a candidate, go over what's required. You see the nutritionist. We get you going through that process. Each insurance company has a different process, usually ranging from anywhere from 3 months to 6 months before you're going to have the surgery. We get you through that process, and then your surgery is usually like in the 4 to 7 months after you see me.
Okay. This question is multifaceted. So is there an age limit for surgery? And if the person does not qualify, do you try to help them lose weight and have a healthier lifestyle?
So age for surgery is 18 to whatever. So it can be into their 80s as long as they're healthy. But 18 it starts. If they don't qualify because they're not heavy enough, then there's medications you can take. And you see the nutritionist. We try to modify your diet. We try to teach people how to meal prep, how to count the calories, how to plan ahead. I would say, like, if you think about a teacher and they have children and they're trying to teach children, if they just went to any chapter of the book every day of the week and they said, okay, we're going to teach from a different chapter every day of the week, the odds of the children learning is pretty poor. And when it comes to weight loss, if you don't have a plan and you don't plan ahead, you don't have a goal, the odds of success are low. That's why if you just go and every day open the refrigerator and choose different foods, the odds of you choosing the right food that's going to help with weight loss is low. People don't understand how many calories are in different foods. For example, like mayonnaise, which is made up mostly of oil, is 90 calories per tablespoon. Right? Oil is 120 calories per tablespoon. So if you take something like tuna fish that doesn't have any calories, and then you take like huge heaping of mayonnaise and mix it in your tuna fish, you just change 90 calories of tuna into 400 calories of tuna. So people say, oh, I was very healthy. I had tuna fish and salad. And I said, well, what was in your tuna? Oh, mayonnaise. And then you have a 600 calorie salad, right? So if you don't understand what you're eating and counting your calories, you think you're eating really healthy. Like, oh, I ate cheese, I ate nuts, I had, tuna. Well, the nuts are high in calories, cheese is high in calories, all high fat content foods. And all of a sudden, like, once again, you can have 800-900 calories in one meal. And if your goal is to have like 1,500 calories a day, you're not going to be at that goal. So after a few weeks, you're like, wow, I've been eating really healthy and haven't lost a pound, and I'm frustrated because you didn't plan and count your calories and have a way of understanding where your calories have to be. So for each person, we'll come up with a plan where your calories should be, follow up, every 4 weeks to see. We usually make our patients keep a little diary or on their apps, on their phones, tracking your foods. And if you do that, you'll do really well. We've had patients that qualify for surgery, but then need 6 months to see the nutritionist, and they meal prep and they follow a 1,200 calorie diet. And after 6 months, they don't need surgery anymore because they've lost so much weight just from counting their calories that now they don't need to have the surgery, and they've avoided surgery just by following certain rules. So not a lot of those patients, but there are patients. So if you follow the rules, it works not only before surgery, it works after.
Okay. What can a patient expect on the day of surgery?
The day of surgery, Well, I'd say it start the day before surgery. So the day before surgery, you just have like light breakfast, lunch, clear liquids for dinner. You come to the hospital depending on the time, like 2 hours before the time of your surgery. You're going to meet the anesthesiologist. You might have called in the night before. Everybody has general anesthesia. The surgery takes about an hour and a half. After the surgery, recovery for about an hour. The most common 24-hour complication with any of these surgeries is nausea, because we're operating on your stomach. We give you medications for that. Say 80 to 90% of people go home the next day. They're on a diet, like clear liquids for a few days, and then soft food if they've had a bypass or a sleeve. And then they follow up in a week to 10 days in the office. And then their diet progresses based on a plan that they've been given. So and that's why usually by the time they come to see me, they've lost, probably, 6% of their body weight the first 10 days because they're really on liquids and pureed foods. So, but that's why they lose a little less the last 2 weeks because they start eating a little more. So their average weight loss is about 8 to 10% of their weight.
So I'm not going to mention this, but one of our audience members is asking, what is the long-term complication rate for a gastric sleeve surgery?
Well, long-term, the complications are very low. Number one, I would say, is like if you have bad reflux, like that's something that people can get. It's probably less than 1% of the people have that complaint, but that's something because the way your stomach gets smaller has less chance to distend, so some people get reflux. That's probably the number one complication. Other than that, there's really nothing. As long as you're taking multivitamin B12, your vitamins are fine. There's no increased ulcers, no increased vitamin deficiencies. So sleeve's pretty safe long term. There's not really many issues except for reflux that you can get. It doesn't you can still have your endoscopies. It doesn't change any procedures you can have. So sleeve surgery long term is very safe. It's actually less complications than lap bands.
Oh, good to know. So are there any apps or online resources that you would recommend for people for weight loss and healthy living?
Sure. I mean, there's Johnson & Johnson through Ethicon has a whole website that they you can look that goes through surgery, healthy living, different ways of losing weight, because they're very involved with weight loss surgery, and they help patients understand the procedures as well as nutrition. So those are always good sites to go to. The National Institute of Health has a big area for health and weight, because obviously it's a big national problem. So the federal government has a huge site on that. And also even the Food and Drug Administration, like on foods, has a whole big national site with a database for calories for every type of food that's out there. And so if you're not sure how many calories are in a specific food, usually if you just Google food and how many calories, you're always going to find out the number of calories in the foods. So I tell my patients, make sure you have a food scale, because weigh your foods if you're not sure, because 1 ounce of pasta is not a lot of pasta. If you look at your pasta box, 110 calories is not half the box. So every box of pound of pasta is 1,600 calories to 1,800 calories. So if you dump the box in the water, you dump it in the cauldron, and now it's all out, and you keep eating it, you're going to eat a lot of calories. So, you don't realize how many calories are in the foods until you actually, portion it out, and you see like, oh, that's not that much. So it's when you start looking at what you're eating, you realize, wow, certain foods are just not a good choice.
Mm. So without naming names, can you share a recent success story of a patient who had a bariatric surgery?
Sure. You want me to share a story who just had one?
Yeah, like a success story without naming a patient name.
I'll go through like long-term, short-term. So there have been people now that operated on 20 years ago. And so they're in their like 20s, and now they're in their 40s, and they've maintained their weight their entire life. So they go from, and it's always amazing how when you're really heavy, there's a lot of discrimination against obese people. So they're in your job, and then when they lost all the weight, a lot of people at work didn't even know who they were. So people that they hadn't seen thought they were new employees. And then their opportunities changed because a lot of discrimination. So all of a sudden they got promotions that they probably wouldn't have had. So, 20 years later, they're now like a vice president of a company that they thought they would never be because, and then the short term, just patients I've operated on recently who had, troubles breathing, very centrally obese, fatty liver, who even after 1 month after surgery have already lost 30 pounds, and now they can breathe better, they sleep better, just with 30-pound weight loss. So it's a pretty fast effect when you lose the weight, and then there's huge long-term effects, from a health perspective and a social perspective that the surgery really benefits patients.
Right. Well, I think that's all the questions we have from our audience, and that's all the questions, I guess, for today. So that concludes today's webinar. Thank you for joining us, everyone.
Thank you.
Please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from a physician. If you need a physician, please call 1-888-724-7123. For more information about Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset. Thank you all. Thank you, Dr. Ward, for joining us today. Have a great day, everyone.